Hi there, welcome to episode 8 of my Pelvic Floor mini-series. Today I'm going to be talking about men, which is quite unusual, as you know that my focus generally with all the work I do is women's health. But men are really important with regards to pelvic floor, and I feel that they are a little bit forgotten in the world of the pelvic floor. A lot of people don't even realise that men have a pelvic floor, but they absolutely do. I was working with a lady earlier this week and we were talking about this, and she said, do they have to pay consideration to that area in the same way as women do? And yes, the answer is absolutely yes, they do. So it's most likely that I'm drawing attention to women watching this video, so it might be something that you pass on to the men in your life. But yes, pelvic floor exercise for men is just as important as it is for women. So I'm going to show you an image here of the male pelvic floor anatomy. Okay, so seeing here the male reproductive anatomy, I just wanted to note when I was trying to find an image of sort of a representation of the male pelvic floor, it is near on impossible, which just shows you that there's really not a lot of emphasis on looking at men and their pelvic floor. But anyway, this kind of shows enough of what I want you to see. So first thing to note is that the male anatomy's only got two openings through the pelvic floor. So they've got the back passage through the anus and then the urethra. So for obviously poo, wee, semen, whereas the female will have the vagina, the uterus as well for sex, getting pregnant and giving birth. So just the two exit through the pelvic floor for the male anatomy. If you just look at the image as well, you can see sort of the orangey bit in the middle is the prostate, and we can see that that's kind of sitting right on top of the pelvic floor. So you can see the abdominal muscles coming down the front, then there's a little bluey bit, and then the pelvic floor is the next bit that we see there. So the prostate sitting right there, and then we've got the bladder above that, and then moving back the anus and the rectum as well. So the role of the pelvic floor in the male to keep everything up and in with regards to the back passage and the urinary tract, but also having a strong role in male sexual function too. Okay, so you've seen an image there of normal male anatomy. So sort of knowing what the normal function is the pelvic floor for a man. So only very slightly different to that of a woman. And in terms of the issues that a man can experience with pelvic floor dysfunction, again, reasonably similar to women. Urinary incontinence, fecal incontinence, pelvic pain, those kind of symptoms that we've discussed in previous videos. But what makes things different is male sexual function. So the pelvic floor is really important for male sexual function. So it's involved in a man getting an erection in the first instance. It's really important for the maintenance of an erection, and also can prevent premature ejaculation as well. So the pelvic floor is involved in the muscles to hold things up, but also for the blood flow to that area. So if we see problems with the pelvic floor, we can see problems with male sexual function. There can be a whole host of reasons for problems with erections and things like that. So it's important to try and get to the bottom of whatever the problem is. But it's important to note that the pelvic floor could be the cause or a component of the problem. So what causes pelvic floor issues in the man? Again, very similar to what we see in women. Obesity can be a problem, that additional weight through the pelvic floor, constipation, drug use, smoking, emotional trauma can affect our pelvic floor as well. Weightlifting, sort of ongoing heavy lifting, a lot of pressure through the pelvic floor, surgery, bowel surgery, surgery of the prostate, bladder surgery, Cycling can cause problems. If you're a real keen cycler and you ride your bike all the time, can cause perineal damage, and the pelvic floor is attached to the perineum. So that can cause a problem as well. So there's lots of things that can cause problems for the man with their pelvic floor. And we just see good old age-related change. It's a muscle that atrophies and weakens just like any other in the body. So it's really important that not only women, but men also develop a connection with this area of their body. So men can experience weak pelvic floor, which will show some of those symptoms that we've talked about, but they can also experience the hypertonic pelvic floor, which I've talked about in some of the other videos, and that is when the pelvic floor is almost overactive, too tight. So we think, how can that be a problem? But with the pelvic floor, we want it to be functional and strong, not tight, okay? So tightness can cause pain, and one of the problems that a tight pelvic floor can cause for a man is prostatitis. So sort of on doing research into this, I learned about this condition. So prostatitis, an inflammation of the prostate, and when I show you the image, I show you where the prostate sits in relation to the pelvic floor. So you either get acute prostatitis or chronic. So with the acute episodes, it's usually a bacterial infection, something like that. But with the chronic episode, again, not exclusively, but the pelvic floor can be very much involved. So if we've got an overactive, a pelvic floor that's too tight, it can cause this prostatitis issue, which causes men pain when they urinate, when they have sex, when just generally pain in their pelvis. So if you know somebody that suffers with prostatitis chronically, it's important that they consider whether the pelvic floor might be involved. And if they do discover that that's a potential, then it would be a physiotherapist, which would be the best person to support them in recovering from that. So I'm quite cautious to keep this video short and sweet because I'm not sure how long I'm going to hold a man's attention with this subject. But just finishing up, I just want to talk about how to activate the pelvic floor. And as with everything I've pretty much talked about, it is very similar to that of a woman. So you can refer back to my previous episode where I talk about how to activate the pelvic floor. So we can do the lifts, the slow twitch lifts, the fast twitch lifts. So for a man, you can try and imagine that you are stopping the flow of urine. So I wouldn't advise that you try and do that mid-flow when having a wee. We don't advise that really for men or women anymore. But just that action of trying to stop the flow of urine and also to try and hold in a fart. It's similar. That's how we think about it as women generally. But you can also think about sort of drawing the penis up and shorten it. And in doing that, you should be activating those muscles as well. So sort of shortening it up and then release. And just for when I talk to women about activating their pelvic floor, it's really important that we learn to lift and engage, but also to release and relax those muscles. And it's exactly the same. So yeah, so look at holding the flow of urine, trying to stop a fart, that sort of back passage motion. And when you get the hang of it, you want to start from the back to the front. So it's like a Mexican way from the back of the pelvic floor to the front and release. And we should be breathing all the time that we're doing that. Okay, so a bit of a whistle-stop tour. Hopefully I've highlighted that men do have a pelvic floor and that it is really important. If you feel that there's any issue there, obviously I'm not a GP, I'm not here to diagnose. My aim with this whole series is to raise awareness. So if you're concerned about your function, your sexual function, go and speak to your GP. If they do think the pelvic floor might be an issue, then a physiotherapist is going to be the way forward for you. If you enjoyed the video, please check out other ones in the series, pass it on, share, leave me a comment, let me know what you made of it, and subscribe to my channel. Thank you so much for listening.